it's an emotional situation and issue for us, but it's also one that where we believe the government needs to step up and show us where the money is going.
That's the message Leslie McBain is sending in an open letter to BC's Attorney General, signed on behalf of Moms Stop the Harm BC, a network of families whose loved ones have died from drugs or have been impacted by substance use. McBain lost her son Jordan McBain Miller in 2014 at just 25 years old. She says her goal is to support the lives of people who use drugs through better drug policy and awareness, much of which is addressed in the letter, calling for better oversight by the provincial government on BC's treatment and recovery industry.
When we spend our huge amounts of money to get our kids in there, to get them well, we need to know. We need success. We need to know the success rates. We need to know the failures. We need to know what can be improved, because we are the consumers of this service.
The open letter calls for a forensic audit of any treatment programs in BC which have received government funding, and for the BC Coroner Service to start tracking deaths that happen at treatment programs and recovery houses. Nicole Luongo, an expert in addiction treatment and drug policy, says there is an incredible lack of transparency in the system.
Around how much money is being directed to the treatment industry. B, the extent to which ostensibly publicly funded treatment centers are actually run privately and for profit, or at least quasi-hybrid public-private. C, we have no insight into what actual outcomes look like at these centers. They're not required to report outcomes systematically.
Luongo says there are also recurring instances of abuse and maltreatment in recovery centers that we don't hear about. The letter calls for an investigation into what Moms Stop the Harm calls the abuse and premature death inflicted upon clients. In May, an independent contractor at a recovery center in New Westminster was charged with 3 counts of sexual assault.
There needs to be very strict, stringent oversight by the government.
In the legislature Thursday, the Minister of Mental Health and Addictions said she's working with the recovery industry on better regulation and oversight, as well as building more access in the public sector for British Columbians requiring treatment. The minister did not comment on any allegations of abuse. In Vancouver, Kate Walker, City News.